Okay, so what treatments have you gone through immediately after diagnosis and throughout your journey with?
Well, there was a lot of testing to determine the diagnosis,
Mhm.
and it was plasma cell leukemia or multiple myeloma,
Mhm.
and it was a very aggressive type, so they needed to move quickly. And they told me that I was going to have a bone marrow transplant, and it was going to be sooner rather than later.
Mhm.
I was in the hospital for 30 days. They started chemo immediately, chemotherapy, and basically their objective was to kill all my cells, so that once I had the bone marrow transplant, my brother, I had two brothers that were a perfect match. They went with my younger brother because he was not on any kind of medication and he was younger. So what they do is they give you all this chemotherapy, almost enough to kill you, so that they can inject you with the new cells, your donor cells, and they want the donor cells to take over. They don't want any of the bad cells left, because then that could mean you would get the multiple myeloma back.
Right.
So I had chemotherapy, 5 rounds of it through 2 months period of time, and then I had full body radiation, 4 days of full body radiation, where they just want to wipe everything out.
Mhm.
And a couple bone marrow biopsies, where they go into your bone and they take your back, and I don't really know what they were looking for from that, but I guess to see how damaged it was.
Okay.
So
It's a lot. Mm-hmm.
that was a lot, and then once they did the bone marrow transplant itself was uneventful. I mean, my brother had to be injected with medication to increase his white blood cell count for several days.
Okay.
And then he came in and they took his cells, just through an infusion. And I had 2 ports. I had one to receive his cells, one to get rid of my cells.
Mm-hmm.
And they just, it was like a 5-hour infusion.
Mm-hmm.
So I was receiving all his cells.
Mm-hmm. It's amazing that they can do that.
Well, it was amazing. Amazing. And then it was, after that, 30 days of isolation. They shut the door. No one's allowed to come in.
Mm-hmm.
I'm not allowed to leave the room.
Mm-hmm.
Like, I wasn't like, they'd bring a bike in because you used to walk the halls, to exercise, but you're not allowed to leave your room.
Was Uncle Marty allowed to be there?
After 15 days,
Okay.
they introduced family members back. But if I left the room at all after the 30 days, I had to wear a mask and gloves. And then when you come home after that, you have to if you leave your house, you wear a mask and gloves. Everybody else, my home had to be totally clean from, professionally cleaned from the bottom up.
Right.
The walls wiped down. Everything had to be sterilized. My food had to be prepared a certain way. They don't want you to have any kind of bacteria.
Right.
Because what happens is they suppress your immune system completely, because your immune system is going to want to fight off the new donor cells, and they don't want that. They want the new donor cells to come in and marry to your body, and now none of your old cells are there. They just want these new cells to grow.
Right. Okay.